You wake up one day feeling more tired than usual. You brush it off, blaming stress or a lack of sleep. But the next day it happens again, and this time, you can barely drag yourself out of bed. Could it be something as simple as vitamin B12 deficiency? This silent but dangerous deficiency is more common than you think, especially as we age. If left unchecked, it can wreak havoc on your body and mind. Don't let it sneak up on you. Today, we're going to explore the most crucial symptoms of vitamin B12 deficiency that you should never ignore. Vitamin B12 is one of the most essential vitamins for your body, yet it's often underestimated. This vitamin plays a critical role in keeping your nerves and blood cells healthy. It also helps make DNA, which is the genetic material in all your cells. Now here's the kicker. Your body doesn't make vitamin B12 on its own. It comes from the food you eat, primarily animal products like meat, eggs, dairy, and fish. So if you're not getting enough of these in your diet, or if your body has trouble absorbing it, you're in for a problem. Why does this matter? Especially if you're over 50. As we age, our bodies absorb nutrients less efficiently, and for B12, this can be a major issue. That's because vitamin B12 deficiency doesn't show immediate symptoms. Instead, it slowly chips away at your health, starting with subtle signs that get worse over time. We all feel tired sometimes, but chronic, unexplainable fatigue can be a red flag. If you find yourself feeling exhausted even after a full night's sleep, it could be because your body isn't getting enough vitamin B12 to produce healthy red blood cells. Red blood cells are crucial for carrying oxygen throughout your body, and when there aren't enough of them, your energy levels plummet. This isn't just the regular, I need a nap kind of tiredness. We're talking about a deep, bone-weary fatigue that just doesn't go away. It can leave you feeling like every task, no matter how small, is too much to handle. So if you're feeling like you can't keep up with your normal activities, and coffee isn't fixing the problem, it's time to consider that a B12 deficiency might be to blame. Have you ever felt a strange tingling sensation in your hands or feet? That's your body trying to send you a warning. Vitamin B12 plays a key role in keeping your nervous system functioning properly. When levels drop too low, your nerves can become damaged, causing that numbness or pins and needles sensation. This symptom is particularly dangerous because nerve damage can become permanent if the deficiency isn't addressed. Over time, you might even notice trouble with balance, coordination, or even walking. All of these are indicators that your nervous system is struggling. Don't ignore this symptom. Early intervention is key to preventing long-term damage. Have you been forgetting things more than usual lately? Maybe you've misplaced your keys one too many times or struggled to remember simple tasks. While it's easy to chalk this up to aging, vitamin B12 deficiency could be at play here. A lack of vitamin B12 can lead to cognitive issues such as memory loss, confusion, and difficulty concentrating. Some studies even link B12 deficiency to an increased risk of dementia and Alzheimer's disease. If you or someone you know has been experiencing sudden mental fog, don't dismiss it as just getting older. Check with your doctor to see if a simple vitamin B12 supplement could make a difference. Have you noticed your skin looking unusually pale or even slightly yellowish? This could be another warning sign of vitamin B12 deficiency. When your body doesn't have enough B12, it struggles to produce red blood cells properly. This can lead to a condition called anemia, which causes your skin to lose its natural color and become pale. In more severe cases, a buildup of a substance called bilirubin, a waste product from the breakdown of red blood cells, can cause your skin and even the whites of your eyes to take on a yellowish hue. This is known as jaundice. Pale or jaundiced skin shouldn't be ignored. It's your body's way of telling you something is seriously wrong. Ever feel winded after climbing a short flight of stairs, even though you used to breeze through them? If you're experiencing unexplained shortness of breath or dizziness, it could be due to anemia caused by a lack of vitamin B12. Without enough B12, your body can't produce enough healthy red blood cells to deliver oxygen efficiently. As a result, you might find yourself gasping for air or feeling dizzy, even after minimal exertion. If this is happening to you, don't ignore it. Shortness of breath and dizziness are symptoms that should be taken seriously, especially if they seem to appear out of nowhere. Did you know that vitamin B12 also plays a crucial role in regulating your mood? If you're feeling unusually down, anxious, or irritable, your B12 levels might be to blame. Low B12 levels have been linked to mood disorders like depression and anxiety. That's because B12 helps produce serotonin, a chemical in the brain that influences your mood. When B12 is low, your serotonin levels can drop, leading to feelings of sadness or even full-blown depression. If you've been experiencing mood swings, it's worth investigating whether a simple nutrient deficiency could be the cause. Feeling like your heart is racing or skipping beats, heart palpitations can be alarming, and in some cases, they may be a sign of low B12 levels. As your body struggles to make enough healthy red blood cells, your heart has to work harder to pump oxygen-rich blood, which can cause irregular heartbeats. If you've noticed this symptom, especially alongside others like fatigue or dizziness, it's worth checking your vitamin B12 levels. Vitamin B12 deficiency doesn't just affect your body, it can also impact your mouth. Glossitis, or the inflammation of the tongue, is a common symptom of B12 deficiency. If your tongue appears swollen, red, and sore, or if you're experiencing pain while eating or talking, it might be due to a lack of B12. In some cases, people with B12 deficiency also develop mouth ulcers. These small but painful sores can make it difficult to eat or even speak. Don't ignore changes in your tongue or mouth. These are your body's early warning signs that something is off. As we age, our stomachs produce less acid, which is necessary for absorbing vitamin B12 from food. Vegetarians and vegans are also more likely to be deficient in B12, since it's found primarily in animal products. If you follow a plant-based diet, make sure you're getting enough B12 through fortified foods or supplements. People with gastrointestinal conditions like Crohn's disease or celiac disease, as well as those who've had weight loss surgery, are also at higher risk because these conditions can interfere with B12 absorption. If any of these symptoms sound familiar, don't panic. There's good news. Vitamin B12 deficiency is easily treated, usually with dietary supplements or injections. Your doctor can run a simple blood test to check your B12 levels and guide you on the right treatment plan. If you're over 50, consider asking your doctor about regular B12 screenings, especially if you've noticed any of these symptoms. Catching a deficiency early can prevent long-term damage and improve your overall health. Vitamin B12 deficiency may not seem like a big deal at first, but its effects can be serious if left untreated. The symptoms are often subtle and easily mistaken for signs of aging. That's why it's crucial to pay attention to your body and seek medical advice if you notice any of these red flags. Don't wait until it's too late to address a vitamin B12 deficiency. With the right treatment, you can restore your energy, protect your nerves, and even improve your mood. Take action today. Your body will thank you tomorrow. Thank you for watching. If you found this video helpful, don't forget to like and subscribe for more health tips.